Risk assessments. Risk assessments are important for any setting because it makes sure the setting is safe for children, staff and parents, and is an early years foundation stage welfare requirement, and is also good practice. What is a risk assessment? A risk assessment is identifying a hazard which might cause harm, making sure that the risk attached to it is acceptable, and putting appropriate control measures in place if the risk is not acceptable. What does Ofsted say? Providers must take all necessary steps to keep children safe and well. At least one person who has a current paediatric first aid certificate must be on the premises and available at all times when children are present, and must accompany children on outings. Staffing arrangements must meet the needs of all children and ensure their safety. Providers must ensure that their premises, including overall floor space and outdoor spaces, are fit for purpose and suitable for the age of children cared for and the activities provided for on the premises. Providers must comply with requirements of health and safety legislation. Providers must take reasonable steps to ensure the safety of children, staff and others on the premises in case of fire or any other emergency, and must have an emergency evacuation procedure. Sleeping children must be frequently checked. Providers must ensure that they take all reasonable steps to ensure staff and children in their care are not exposed to risks and must be able to demonstrate how they are managing risks. Providers must determine where it is helpful to make some written risk assessments in relation to specific issues, to inform staff practice and to demonstrate how they are managing risks if asked by parents and/or carers or inspectors. Risk assessments should identify aspects of the environment that need to be checked on a regular basis, when and by whom those aspects will be checked, and how the risk will be removed or minimised. So what can practitioners do? Do an overall risk assessment of your building annually or more often as needed. Walk through the setting room by room and note anything which might be a hazard to someone and say how the risk is being controlled. This should be kept on record and referred to and updated appropriately. When updating, refer to the accident and incident log to see if there are any hotspots which need addressing. If any changes are made to the environment or equipment, this can be added in. The risk assessment should refer to emergency exits and procedures for emergencies. Do risk assessments for your equipment, activities, policies and procedures on a regular basis. These assessments should take into account the numbers, ages and abilities of children in your resources, planning, staff and space. They need to be evaluated and reviewed regularly. Check that nothing is damaged and that toilets and all areas used by children are clean on a daily basis. Make sure that you have enough staff to meet the needs of the children and the activities planned, and that there are no changes which could cause a danger. This is particularly important in shared premises. This can be done by using a chart on the wall which can be initialed when an area is checked. Risk-taking. There is quite rightly much emphasis on keeping children safe in early years settings, with a duty to minimise risk in all situations. However, children need and instinctively want to be able to take risks in order that they can test their abilities and strengths. Thank you for listening. Here are my contact details.